My name is Tony Sosebee, and I'm a machinist at James Tool in Morton, North Carolina. Been working up there about 7 years. I've had a problem with my hips for about 2, and I'm getting it fixed. It got so bad I couldn't walk. I just couldn't walk anymore. So I went to the doctor. They told me that about the problem I had with both hips, and they both had to be replaced. They said I was young for this kind of surgery. That normally the type of hip that they put in lasts about 20 years, but they put a ceramic hip in me. It's 30 plus years. My regular doctor referred the bone and joint clinic to me, and that they assigned me that Dr. Friedman, and he's very good. He's very professional. He's very informative. He answers all the questions in as much detail as I want them, and makes me feel real comfortable. Never pushed me to have the surgery. Told me that that when I was ready, I could come to him. And so I had to think about it a little bit and get over being upset about somebody cutting on me. And when I was ready, I called him and we got it all set up. Oh, there's lots of things. I've got a small little Harvey farm with animals and things, and I've gotten to where I can't get out and work with that and clean the yard up. Last summer, it was so bad last summer. I have a riding lawnmower. I couldn't get on the riding lawnmower. Spread my legs to straddle the riding lawnmower. My wife had to cut the grass because it was too painful to be on it. So I'm looking forward to just cutting grass this year. First off, the only time I've ever had anybody cut on me was when I was 3 years old and had my tonsils taken out. And so it's the thought of going into surgery scared me to death. And when he told me I was going to have them replaced, and he showed me the X-rays, explained why, I just couldn't cope with it. I said, no, I can't. I'll have to think about it a while. But it took me less than a week to come to terms with it, and I called him up and told him I wanted to get it done. There was no pain with it at all. It was marvelous. I was in and out of it, and within less than a week, I was walking on my own without crutches, without anything. No bruising to amount to anything. No problems whatsoever. In the early 80s, my dad got a satellite dish, and I watched a hip replacement surgery back in the late 80s. And frankly, it looked like butchery. And when he told me about that, those things flashed through my head, those pictures I remembered, and it scared me to death. But I also know that there've been great leaps in technology at the same time, and I just wanted to do one thing: make sure that I didn't remember any of it. And I know you could do an epidural, and I've heard that some people remember things, didn't want none of that, and so I was lucky. I didn't remember any of it in the surgery. I woke up with no pain. They asked me if I was any pain. I said no. Matter of fact, I'm in less pain than when you put me to sleep. And it really was. I said, I got a little bit of a cramp. I said, can I wiggle my leg to get the cramp out? They said, no, we've got to give you some medicine for that. Well, that's the last time they gave me any medicine because it was too much because I just wasn't in any pain. The next day, they got me up, and the first thing I noticed when they stood me up was that there was no pain in that hip. The second thing I noticed that the hip was longer than it used to be. It was a little crooked. And I talked to him at my next visit about it, or the next day he came in. And they do that on purpose because the joints have worn way down, and they compensated for that. They got me to walking with a walker immediately, and instead of just walking outside and back in, I walked down the hall, all the way down to the end of the hall, and instead of gripping my walker, I was just holding on to it with 2 fingers under my own weight, and just using the walker to push it around. I mean, it was that much difference. He also said that the surgery, he said, when they do the surgery separate, I'm going to have the other one, that he would correct the hip problem. It's easier to correct that way because of the technology they have. So I'm looking forward to that. I'm pigeon-toed. I've always been pigeon-toed all my life. And my mother noticed when we were walking that my right leg is straight now. My foot is straight, and my left one is still crooked. And he said he can fix that too. So, for the first time in my life, I'm not going to be pigeon-toed. I went back to him 2 weeks to have the staples taken out, and I said, I'm ready to go back to work. He said, okay, I'll let you go back the following Monday on a limited basis. And I wasn't in any pain. So 3 weeks to the day I went back to work. And I worked 1 day. And the right leg was marvelous. No pain whatsoever. But my left leg, it's got the same problem. And it flared up. It flared up and started hurting so bad that I told him, I said, I got to have the other hip done now. January 5th was the last day I worked. After that, from the end of the 30th, I couldn't take a step. It was like the pain in my right hip was like somebody actually had a screwdriver stuck between the joint and was twisting it. You never knew when you stepped down on it whether the sharp pain would be there or there'd be no pain. And then when you shifted your weight a little bit, you might get that pain, you might not. But within 2 or 3 steps, you knew you was going to have it. And you never knew if it was going to fall on your face or not. Now I don't have to worry about that. I was on a walker, and instead of moving one leg, I was moving both legs at one time, setting them down, and then moving the walker. And literally, I got up after the surgery and walked. They were marvelous. It's set up specialized just for the joint surgery. They try to get everybody in at the first of the week together and keep people together that's all had the surgery, and it makes it more comfortable because you're around people that have had surgery like you. You get to do therapy together in group, and you get to talk to each other about the things that you've had, problems you had. I was the only one that particular week that had the hip surgery. Everybody else was knee, but I enjoyed all that, and we got to learn some basic exercises. I guess the difference between me and them and the specialized surgery that I had is that there was no restrictions when I went home, and none. And there was no therapy that I had to do except walk. I didn't have to have any home health kit come out. I didn't have to go anywhere to have any kind of exercises done. All I had to do was walk. His confidence, he is... originally, the people that I worked for said, don't go to just any doctor that had this done. My mother's had this done. My father's had this done. Relatives have had this done. We'll go to Charlotte. We'll go to the best there is. These people tell other people how to do it. We'll give you these people. They'll be hard to get in to see, but there's nobody better. And I took the number, but I was in so much pain I couldn't wait. And he's every bit as good as any of them, I think. He's confident. It's I hate to say it this way. He's almost to the point of being cocky. I mean, he's so confident he knows what he's doing that it just spills over with him. And it's a good feeling, really. It makes you feel like the man knows it's not going to mess anything up. He knows exactly what he's doing, and he does. Everybody was just as nice as they could be. They were outgoing. They loved to talk. Explain everything they did. Really very attentive. The food was good. I ate every bite of everything on my plate every time I was here, and I told the dietitian that when she came in to ask questions, and she just danced on the floor. And I asked about the dessert I'd had the night before, and she said, I got some more. I'll give you some more today. And so I had 2 desserts the next day. And it was excellent. It was all excellent. I couldn't ask for anything any better. I'm gung-ho. I'm looking forward to it. And I hope it's just as easy. Now, Dr. Friedman was warming. He said, I do everything exactly the same every time. But he said, results don't always come out the same, exactly the same. They vary a little bit. And he said, there's no way to figure out how that does that. It's just, that's the way it happens. He said, so I'm going to warn you, it may not be quite as pleasant as last time. I said, ain't worried about it. If it's anything close, it's great. And so I'm looking forward to getting it done so I can get on with my hobbies and the things I do and go back to work. I love the kind of work I do, and I'm looking forward to getting back there. A little bit of yard cleanup and get a garden ready. I like to garden. I found I can get down on my hands and knees. A little bitty garden I have about the size of this room. I can get down on my hands and knees and work it, and I was worried that I couldn't do that with hip problems, and now I'm looking forward. I was looking yesterday in Lowe's at some of the plants to plant. I don't plant a tree in my yard if it don't have fruit on it. Okay, I'll give you an example. And I've got plums blooming right now. I've got apricots blooming right now. I've got pears blooming right now. I've got apples blooming right now. And I'm wanting to put some thornless blackberries in. So that's what I'm looking forward to doing. They said I should have had it done sooner. They missed me real bad. They've been very, very easy to get along with on this. They refused to let me pay for my insurance while I'm out. I couldn't believe that. And they said, we'll take care of that when you get back. And I said, I couldn't believe that. They said, no, it's the people that are really good, we take care of them. And they said, just make sure that you're ready to come back. That you're ready, you're able to work when you come back. It's not hard as far as physical work. It's a lot of standing, and but you use your brain a lot. And you've got to think about what you're doing. I do precision grinding work, and it's a temperature controlled room. Just a few of us working there, and we do the high precision work. They are ISO certified. They're ASC certified, which is aerospace certified. We're one of only 14 shops in North Carolina that are ASC certified, and we're the largest job shop in North Carolina that's ASE certified, and I'm very proud of that. We do really high-tech work. I've had fixtures come through that I've worked on in the last 7 years. One of them said, aileron fixture, space shuttle. And it blew me away. I'm like, whoa, I'm getting to work on space shuttle stuff. You know, nuclear work, undersea stuff for submarines and things like that. Really, really high-tech things. Exotic materials of all kinds. I guess I was the worst candidate in the world because since I'd never had surgery, really, you know, and I never wanted to ever have surgery. I was scared of it. To have it done and to come out so good, so easy, and I'm looking forward to getting this other one done and going on with my life. It's no problem at all. It's nothing to be afraid of. It's not a problem, and there's good quality care here, and that makes you feel good about it all too. It really is a good quality place.